So taking a step back, I decided to see healthcare as a machine, as opposed to just the cogs within the machine. So just simply fixing the cog, I decided to take a step back, look at the machine, and see what best can be done to improve it.
How do you integrate AI into the system? How does it work?
Due to that slight change, because that was accounted for, surgeries on average increased from 4 to 5 to almost 7 surgeries per day. So that was something that was done without any additional cost, I'd say. So that was something that for me was quite an achievement.
There is no such thing as perfect.
You'll never be ready. If you think you're ready, you're never gonna be ready. So at least get to a point where you're at least 80% ready. Get to a point where you're confident that you can at least make it work out, and take the step, take the leap of faith.
What do you say for people that are trying to follow your path?
Explore different things. Life is too short to just stay on one certain path. Explore different things. You never know, you might be best at doing something that you never could have dreamed of.
Okay, thank you very much for joining, guys. Appreciate it. Today it's a different episode. We have a special guest, actually. He's our first physician here on our show. We're going to be talking about why he chose health in particular. And he's also going to share with us a business that he started called Dawraty as well. And it's going to be a very interesting episode, actually. So stick around. And just a quick reminder, guys, just make sure that you share this episode with your friends. And don't forget to like and subscribe, please. Okay. Thank you very much, Dr. Ryan. Appreciate it.
Thank you for having me, Sulaiman. It's an honor.
Yeah, me too. Thank you. So can you please talk with us about your how all of it started? Like, how did you enter health from the beginning?
All the way from the beginning?
Yeah.
Okay. First of all, I come from 2 parents that were both in healthcare, albeit one was in education in healthcare, and my mom was a radiologist. So pretty big on healthcare in our family. So it was a given that I'd enter healthcare at some point. But at the same time, I wasn't so inclined into taking the same path. So when I entered medicine, at first, as is the case with most medical students, we choose the most difficult specialties. So that would be heart surgery or brain surgery or whatever's on Grey's Anatomy. So you just see that specialty and you'd want to be a part of that as well. But the reality is, rarely does anyone go into those specialties. And the most of us are more or less the front line when it comes to medicine, which is either family medicine or internal medicine, which is what you see as soon as you enter a hospital or a clinic. So I came in with big aspirations and I wanted to leave an impact, so to say. So that's how I joined medicine initially. However, my trip did kind of veer off that path and I did end up choosing a few different ones. But with experience, I'd say I would do it all over again if I was given the chance.
So did you run into any hard days or was it like in your genes, maybe like you know the path, you know everything from maybe your family, or was it like much easier than other people? Maybe
I wouldn't say it was easier. However, I did say there was a lot of pressure from my family to get into this specialty. I also have 2 sisters that are also in medicine, so being a part of that ecosystem pushes you to a certain outcome. So being in medicine, I'd say it was difficult. I won't sugarcoat it, but I do believe, whether it be medicine or anything else, given enough time and effort, you can get there. So when it comes to medicine, I'd say if it wasn't for my time management skills, I would have probably dropped out. As I think we'll be discussing for a lot of this episode, I happened to run into different let's say interests outside of medicine, whether that be marketing for one or education, seeing as how I managed to keep myself busy with topics outside of medicine. So managing my time effectively, whether that be studying medicine or other interests that I had, kept me sane throughout those years. Starting off in Kuwait, working in the Kuwaiti system, whether that be in the public sector or 𝐾𝐨𝐧'𝐭 Hospital, I was introduced to different mentors. It was an interesting environment, so to speak. And then moving to Boston to further my studies and a career, working there in Mass General, it was also quite a different experience. The healthcare system is drastically different. So I'd say the biggest thing was how they viewed patients in a holistic way. So their treatment course was a patient-centric approach. So they'd see a patient and they'd see them not just as a number on a sheet or just a problem there to be solved. It's a person here with they can come from a different background, they can come from different concerns, they have different circumstances. And how can we resolve those in the best possible manner? So I'm not just here to treat your disease or treat whatever ailment you might have. I'm here to make sure you leave much better than when you came in. So that's generally how it's seen. And you can see that in the different parts of the system. So we call this patient flow. So when a patient first enters the hospital and once they leave. So during that entire process, every interaction that you go through, whether it be at the reception, whether it be with doctors or nurses, every part of that is thought through. So that was my experience in Boston. But when I was at Massachusetts General Hospital, a mentor of mine actually led me to pursue, I'd say, something a bit different within healthcare. And that's to leave the clinical practice and join something different, which he recommended, which was healthcare management. And at that point, that's when I decided to pivot from my work as a physician clinically to a healthcare management position. And that's when I joined a program at Johns Hopkins and I got my master's there to pursue that degree.
Nice. And congratulations, by the way.
Thank you very much. Much appreciated. It wasn't easy, but we got there.
Yeah. Okay. So you were running a marketing agency while studying. It's called Signed Marketing. Tell us about that experience.
Yes. So during, as I mentioned earlier, when I was in medicine, I had other interests. And managing those and balancing those was one of the things that kept me sane. So not just allocating enough time for my studies, I also had enough time to pursue my interests. And marketing specifically was something that I always had in mind, creating something out of nothing. So having branding or creating a visual identity for something. So that was something I was always interested in. And it all comes down to curiosity to an extent. So when it comes to Signed Marketing Agency, so I remember this was my last year of med school. Some might say it's the most difficult or the hardest years. I decided to open up a company during that time, and that was Signed Marketing. And with the help of some of my colleagues, we were able to launch this company and work with other companies, whether it be a small startup all the way to large corporations in different industries. And we were able to work with companies in Kuwait and Saudi Arabia and the UAE. So it was a very interesting experience. It opened my eyes and broadened my vision to different industries outside of medicine. So I was very limited to the mindset of healthcare and what healthcare means. I didn't think to venture out of that bubble and think of what other industries have been doing. So I can definitely say that my time at Signed Marketing was it was inspirational and influential for the rest of my journey.
What type of business were you doing in the Signed Marketing? Is it related to health or something?
Not at all.
Something
so
totally
very different. So it was a marketing agency. We consulted, we created events, we did branding services, social media services, web development. So it was everything you can think of on the spectrum of marketing. So very different from medicine. Nothing that would have been taught in medicine was something that I practiced there in Signed Marketing.
Okay. So Dawraty.
Yes.
How did that idea come to you?
Okay. So Dawraty is something else I was interested in. As I mentioned, education. I also had one of my parents that was in education as well. And it was, for me, it was a curiosity as well, but it was also a problem that I had seen that I wanted to solve. So I've always been this person that wanted to solve problems, whatever that may be. So being a student, I noticed that there were certain problems within education. It could be limited here to our education system. It could be something universal. But at the time, I knew that it was something that needs to be fixed. For me, it had to do with mostly one of two things. It was the relevance of the educational content and the personalization of the material. So going through the 7 years of medicine, the content was more or less outdated. The resources were all over the place, and we were at a loss as students. There wasn't much we can do, or not a lot of people we can go to. So that's where Dawraty came into play. We wanted to create content that was both relatable. So instead of simply importing content from abroad and have it translated, we had content created for local students by local talent. So everything was built in-house, developed in-house, in collaboration with our team of expert instructors. So that was one part of it. The second is the personalization. So we all as people learn in many different ways. I, for example, can understand content and retain knowledge better when it comes to connecting dots. So bring this piece of knowledge or piece of information and connect it to another. So flowcharts was the best way for me to study. And I used to do that as a student, but there wasn't any available resource that would help me get there. So I had to do everything myself. That's where Dawraty came in to fix that issue. So having that personalization, so you as a student would be able to choose how the content is viewed by you. So Dawraty would be able to create content that would help you retain the knowledge better.
So basically, as you said, you had the doctors from Kuwait, and
Correct, yes.
and you wanted people, and because you're basically talking to Kuwaiti students, and so they want something that they can relate to, especially like with their curriculum and stuff.
Yes, correct.
So I don't know a lot about the the medical field, but do they have different curriculums everywhere, like in other countries and stuff like that, or is it universal? Or
so to an extent, most medical curricula branch out from either the US, Canadian, or the UK or British. And every country has their own version of that, more attuned to the local customs and the cultures and whatnot. But when it comes to, for example, if I were to speak to Kuwait, a lot of that content, when I say outdated, the notes might have been created by professors 10 to 15 years ago. I would think that the doctors of the future would need something more relevant to the times that we are at right now. So that's where I believe having the most recent up-to-date knowledge and information accessible, that's a solution I'd say most students would be looking for. And adding to that, as students, there were a lot of efforts put in place by different students to piece in different notes, lectures, just to help support different students throughout their career. So there was effort in it, but not a system that supports it. And I believe that's where Dawraty comes in. It provides the necessary support to have students, recent graduates, provide their knowledge and their expertise to other students, wherein I myself as a student can help support someone else through the knowledge that I have by becoming an instructor through Dawraty. So having that system in place and having that support, I think, is one of the main pillars of Dawraty.
And do you see Dawraty only in the GCC countries, or are you planning to extend maybe to the US, UK, and the whole world, basically?
So there was actually a plan in place where we'd offer some of our content to the UK, seeing as how in Kuwait, a lot of the healthcare system here is based off of the UK, so it's more or less similar. But given our current strategy in place, it's better suited for us to provide whatever it is that we can and support the education system that's available here first, whether that be to neighboring countries. Currently as Dawraty, we're available in Kuwait, Bahrain, and Jordan, soon to be in Saudi Arabia as well. So having that system in place, making sure it's well positioned, and then later, yes, we do have in mind other countries that we're willing to target.
Nice. And what makes it different than other platforms?
So I'd say that there are a lot of educational resources out there. The oldest might be a textbook. And I think that Dawraty, compared to any other educational resource, provides content in ways that are tailored to your learning habits and preferences. So having content that is tailor-made, very similarly to how you'd get let's say a 𝐦𝐨𝐫𝐞𝐿 made, down to the very minute details, that's something that not a lot of resources out there can do.
Nice. More detail-oriented. Yeah.
Yes.
Nice. So how do you balance healthcare and education and tech? I know like these three, they are so different,
Yes.
but how can you make sure that all of them are within standards?
So if I were to summarize this, I'd say it all comes down to alignment. So making sure that this, whatever specialty it might be, whatever interest it is, that aligns with your core vision and principles that you have as a human. So if I were to talk about pivoting from healthcare to education to marketing, as long as I have a certain mindset in mind, it'll stick through no matter what the specialty is. No one person can do everything themselves. I myself am only limited by whatever skills I have. So if you want to go far, it's not just about building products, but building people. So empowering people and teams to excel within their realm and their domain, and having myself, if we were to speak about how Dawraty is operating, as the anchor for its values, and having all of these work together in a seamless system. I think that's best how you should approach a business.
I read somewhere that you use AI in Dawraty. How do you integrate AI into the system? How does it work?
Correct. So initially when Dawraty started out, we would provide courses that are specific to the curriculum. However, they weren't specific to student needs. So I'd say we're in a bit of a revolution here. We're in the age of AI. So integrating that, we've invested quite heavily in terms of time, effort, and resources to have AI integrated within our systems. So having AI is not something quite simply done a lot of businesses. The good thing about it is that we have a team, I'd say, that is diverse enough and capable of implementing this. So having, as I mentioned earlier in our conversations, one of our founders, Nasser, he's our CTO, he had most of his education in the US. He's worked on a startup for a year in the US abroad as well. And he helped develop one of the, I'd say, leading banks app in Kuwait as well. So he's very well versed in first the needs here in Kuwait as a population, in addition to the latest technologies abroad. So he helped bring this vision to life. So bringing that technology and integrating it to something that would also take into consideration the, let's say, the local customs and in consideration, that's something that isn't easy to do, but I think we managed to do it given the team that we have.
What are some of the biggest challenges you had with Dawraty?
So I wouldn't classify it as a challenge. However, it was something that frightened us at first. So having worked with healthcare students here in Kuwait, it's where I went to medicine. It's something I'm familiar with. And we're always comfortable with what we're most familiar with. But when it comes to business, it's also important to step out of your comfort zone and do something that you might not have done before. With a proper plan and strategy in place, you can eventually get there. So with Dawraty, having expanded outside of Kuwait to Bahrain, to Jordan, it wasn't an easy step. But what gave us the confidence to do so was the team that we had in place with their skill set, and equipped with our guidance, they were able to lead the launch of Bahrain, that was about 1.5 years ago, and Jordan about 6 months ago. And I can say confidently that both were a success. So if I were to say anything to business owners taking that leap of faith, as long as you have a proper strategy in place, take that leap of faith, because you'll regret it if you don't do it. So might as well take that step and then slowly alter. If it doesn't work out, you can perhaps learn from that. But if you don't take those steps, you don't know what's missing in you.
Always start, basically. Yeah.
Yes, you should always start, because if you just sit by the sidelines, life will pass you by. You don't know what opportunities you missed out on. So taking that decision, taking that step, it's something you won't regret years down the line.
Yeah, that's just very important, guys. Or even my other guests were saying saying similar stuff. It's very important to always start, always jump in, and then figure things out as you're, inside it, rather than just trying to be ready or trying, to make everything perfect. There is no such thing as perfect.
You'll never be ready. If you think you're ready, you're never gonna be ready. So at least get to a point where you're at least 80% ready. Get to a point where you're confident that you can at least make it work out, and take the step, take the leap of faith.
Nice. Where do you see Dawraty in the next 3 to 5 years?
So I'd say that Dawraty, currently we're focusing mostly on healthcare services, healthcare specialties in particular. In the next 3 to 5 years, I'd like to see our services being provided to more specialties, whether that be adjacent specialties such as allied health or public health, for example, but also other science majors such as engineering, for example. The way I view Dawraty isn't a learning platform, it's more of a learning ecosystem. So it's a resource that can be used by students just like how you would use a textbook or your notes or a paper and pen. That's how I view Dawraty over the next 3 to 5 years.
And I think it's divided to. I saw through Instagram. They have first year, second year, third year. So basically, what you guys did is you took all the courses and basically put all of it, like all students in the healthcare specialties can benefit from Dawraty, regardless of their subdisciplines or
correct.
Like
So usually medicine is divided into certain specialties. However, once you get into medicine specifically, you and your peers will be in a certain cohort from first year to seventh year here in Kuwait. Other regions, it might be up to 6 years. And then you also have dentistry, you've got pharmacy, you've got allied health. So each of these are different specialties that more or less follow a certain predetermined path. So what we've done is we've taken that curriculum for your entire journey throughout your medical profession and integrated that in Dawraty. So whether you're a first year in medicine, whether you're a 5th year in dentistry, that content would be available on Dawraty.
You're now a senior manager at Royal Medical Group.
Yes.
Tell us about that experience and how did, like, one thing that you're proud of in that field, maybe.
Of course. So implementing the knowledge that I've gained. So this was my first experience after graduating from my master's, as I mentioned, the healthcare management. So implementing all the knowledge that I had taken, so putting the theory into practice, was quite an interesting thing to do. So I've worked on different projects when I was in the States. We actually worked on one of the hospitals there. So there was this hospital where they had this orthopedics department. So bones, joints. They wanted to optimize the efficiency of the operations that they were doing. So how many surgeries they were doing every day. So they gave us this experiment. What can you do to help improve the number of surgeries that you can do every day? So everyone was thinking, okay, we'll build an extra operating theater. We'll hire more surgeons. So there was a lot that people out there were thinking. However, myself and a few friends of mine, during university, we came up with this different idea. What was taking the most time, or let's say what was something that was draining a lot of the time and then resources and leading to that delay that they were seeing? So they were doing about 5 surgeries a day. One of the main things was the complications that would occur due to obesity. or high body mass index. So having high BMI, that would lead to certain complications. That would in turn delay further surgeries and operations. So instead of them averaging, let's say 6, 7, 8, they were getting 4 or 5 every day. So what we simply did, without any extra cost, without any extra effort, was simply classifying patients based on their weight. So every given day, based on your weight, you'd have a certain date set. So let's say Sunday's a weekend, but let's say Mondays. So Monday, you'd have high BMI patients. Tuesday, you'd have normal BMI patients. And then you'd alternate between them. Due to that slight change, because that was accounted for, surgeries on average increased from 4 to 5 to almost 7 surgeries per day. So that was something that was done without any additional cost, I'd say. So that was something that for me was quite an achievement. And then working with Royal Medical Group, so mostly consulting other healthcare institutions, we look to optimize workflow and patient flow more specifically. So having patients come in, I think most of us have been sick at some point, and going through that process in the hospital can be quite tiring, almost as tiring as the sickness itself. So optimizing that so that you don't end up wasting a lot of time, that for me is something that I really enjoyed doing, and I still enjoy doing.
Yeah, that's actually interesting. With like a small tweak, you can make big impact.
Yes.
Yeah. Since we're talking about the United States, I think they have a different system, the insurance system.
Yes, they do.
This is like a side question, but do you prefer the insurance system or the free system? Which one of these two is more optimal, I'd say?
So we can spend hours debating the different healthcare systems. I definitely would not choose the position that the US has in terms of their healthcare system. It has left the most vulnerable of the population, even those that are better off, in quite a dreary position. So access to healthcare is quite difficult there. I myself went to a hospital because of food poisoning and ended up spending 6 hours. Here in Kuwait, you generally spend an hour, maybe 2, not that long. So speaking from a patient's point of view, I would not choose the US healthcare system. But speaking from, let's say, the view of those who are planning on innovating within the field, those who want to explore and create new medications or treatments or drugs, they would probably choose the US system just because they're fueled purely by profit. So having that incentive there drives all forms of innovation. So it's a bit of a double-edged sword. So you have patients that aren't receiving, let's say, ample or adequate care or attention because of how long the process is. And it's quite draining in terms of, let's say, if we were to speak financially. But at the same time, they're getting the best treatment out there, or their latest treatment out there at a cost, of course, because of the for-profit incentives that are out there. So again, it's a double-edged sword there in the US, which isn't something that I would opt for. I would say something in Kuwait, perhaps with a few tweaks, would be ideal. To compare the healthcare system in the US and Kuwait a bit further, since the US is a for-profit system, physicians and doctors and surgeons are incentivized to perform more and more surgeries, even when the patient does not require it, because there's a financial motive behind that. Here in Kuwait, and I think a lot of people take that for granted, that's not necessarily the case. The physician has your best interest in mind. There's no financial motive or incentive behind it. If you were to go to any of the hospitals in Kuwait, their motive is to help get you on the path to treatment as best as possible, or in the fastest way possible, if that is what's best for you. There's no incentive behind it to help to get patients to perform more surgeries, or have more surgeries performed, as opposed to the US. So here in Kuwait, it's not just surgeries. You have very short waiting times here in Kuwait as opposed to the US. And that can only be done when you have a lot of healthcare institutions in place. So almost every area in Kuwait has a healthcare clinic. Almost every government has at least one major hospital. So that's healthcare system that's integrated within the infrastructure here in Kuwait. You have easy access to healthcare, whenever you need it. And once you do enter into the healthcare system, albeit there might be some issues throughout, it's not the best, it's not perfect. However, you're treated with the utmost respect. You're dealt with in a very timely manner, and you're not forced to do certain procedures that you don't want to or are not in your best benefit or care, as opposed to some of the hospitals in the US. The Canadian system has something a bit different when compared to the US system, in that your taxes fuel the healthcare expenditure. So if, as a citizen, you'd pay your taxes as normal, and then you'd end up getting healthcare services. Due to certain policies within the country, increased immigration, lack of hospital care, there's been an overload in the need for healthcare services, and that has impeded healthcare access. So you can't easily access healthcare in Canada because of certain policies. The system, however, remains as quite an interesting system that can be adapted here in the region. But again, as I mentioned, due to certain policies within the region, it hasn't worked out as well in Canada. On the other hand, you have the German Bismarck system, which is one that I would favor above many of the other systems. The way it works is 7% of your income is taxed specifically for healthcare. So that 7% would enter into a fund, a healthcare fund. That fund can be invested, can be used to fund all healthcare services within the region for all citizens. And at the same time, there's a supervisory body that supervises all healthcare expenditure. So private hospitals within the country, they would have their prices set depending on what they deem fit. Certain services, certain policies would all have to go through that supervisory body. But as a patient, you'd have access to any of the hospitals within the country. Seeing as how you spent that 7% on taxes for healthcare specifically, you can have your entire treatment funded by that healthcare fund. So what happens here is you've managed to tackle access to care. So you have access to any of the hospitals out there. At the same time, hospitals are incentivized to an extent to innovate further. And healthcare institutions, healthcare companies as well, whether that be medical devices, equipments, pharmacies, laboratories, pharmaceuticals, they're all incentivized to innovate further for a chance to get a percentage of that fund by way of the healthcare services that they're providing to patients. So I, as a patient, let's say, if I were to get a certain procedure done, if that costs, let's say, 100 KD, if a certain hospital can do it better, they can charge 150 KD. And that way, you'll be getting a bigger market share. You'll end up getting that profit as an incentive for companies. But at the same time, it opens the path for a lot of different healthcare institutions to provide their services to citizens and innovate at the same time. So that tackles the for-profit nature of the US, or caps it at least. So in the US, policies, lobbying, pharmaceuticals have the power to change even healthcare policy. That's how far it's gone. But when you compare that to the German Bismarck system, there is a certain cap to what it is that you can profit from this. So it doesn't go into the extent where it enters politics. However, at the same time, it is there for the welfare of the citizens.
Interesting. And you said 7%. It can be more than enough for it. It's a proven system. It doesn't have any like cons, or some people, maybe some people would have trouble waiting or not having. Maybe their surgery is very expensive, and how do you work through that?
So there's another solution that they've implemented for, let's say, people who don't mind paying a bit extra. So there's something called a statutory health insurance. So you'd pay more than 7% if it is something that you're willing to do. You can pay extra and get supplementary insurance or private insurance. So that insurance would cover even more procedures. So let's say dental, for example. Dental is only covered to a certain extent. You can't have all your dental work covered. Or let's say cosmetics or plastic or whatever it may be. So that can only be covered to a certain extent by the 7%. So if you were to get additional insurance, the option is there. However, you're obligated to pay that 7%, and that covers all your healthcare services to an extent. And at the end of the day, all we want is our health and safety. So having that 7% cover that, I'd say reassuring. Anything extra you can pay as you go or have extra private insurance. So the option is there if you'd like. So one of the great examples that I've witnessed here in the region, actually in the UAE, is a digital triage system. So what happens is, let's say you're on your way to the hospital. Let's take a step back, even before that. You're not quite sure whether your issue warrants a visit to the hospital. You go into this app, you pop it up, and then you put in your details, what the issue is, if there's something you want to take a photo of, and you get, in a sense, very primarily diagnosed with what your issue is and whether that warrants a visit to the hospital. That's made possible through the efforts of digital transformation and supported by artificial intelligence. So I know a lot of our talk has been about digital transformation, AI. So this is one of the examples that when implemented and done well can create lasting impact, because as a patient, we're generally quite vulnerable and scared. We're not sure who to go to help or which approach to take. So having that to support and reassure you even before you step outside of your house is life-changing. So having that app, you'd go in and then you put your details in. On your way to the hospital, you've already been, in a sense, classified, diagnosed. They already know you're about to visit the hospital. So once you go in, you're matched with a specialist that knows what your issue is, or at least primarily has diagnosed it or has a differential diagnosis that they want to go through. And your visit time is cut from 3-4 hours to simply an hour wait. And that cuts down on a lot of resources and effort. You can only imagine just the reassurance of being told we have someone that can help you even before you get to the hospital. So I think that's one of the major benefits of implementing digital transformation AI.
Yeah, that's actually smart. If all the hospitals implement that, it's going to be much, much better, especially because sometimes I heard stories, and sometimes I had it with one of my family members where they go to a hospital and then they say, oh, we don't really, know a lot about this. We will refer you to another doctor somewhere else, So these things happen, and I'm pretty sure it happens a lot in the US as well.
Of course, it's not wrong for a physician to not know what's wrong with you. We're not all knowing. Our knowledge has a certain extent, and that's why you have specialists and you have people that are specialized within a certain field. But the fact that you have, for this particular solution, you have an app that helps support you through your journey and helps guide you to the person who can best help you, helps cut down on the time of you having to go to a first clinic, and then in that clinic, them not knowing what you have and then referring you to someone else. That's a lot of time and effort that's wasted that can be very simply resolved through digital transformation.
What are small things patients can do that can help the hospital identify their ailments much better?
So there are certain things that can be done that can help a physician's job easier. And when a physician's job is easier, they'll in turn make your treatment course much easier as well. In Kuwait specifically, and the GCC as well, we have a lot of chronic conditions, whether that be diabetes, hypertension, or high cholesterol, whatever it may be. So it is very important to keep a very proper record of whether it be your medications, how frequently you take them, are you compliant with those medications, what kind of food are you eating, are you following a certain diet regimen, are you following it strictly? And if so, that would help in diagnosing what the issue is. It could simply be you not adjusting the doses as needed. It could be the patient not adhering to the diet regimen that was given. So those simple solutions can be very easily given when the data is there to support it. So here in Kuwait, a lot of those with chronic conditions have those records in paper format. Ideally, with digital transformation, you'd have those on an app or other forms that would make it much easier. Some people have devices that can also track, which makes it a lot easier as well. But generally speaking, keeping a proper record, or what we call history, so having a proper history of your current condition, if it's something new, that will all help the physician diagnose your issue and treat you much better.
Why did you choose healthcare system rather than practicing it clinically?
So having been practicing healthcare clinically, so whether that be during my medical profession or during my time at KOC or during my time in Boston and Mass General, there's always that impact to be had, that satisfaction you get when a patient comes in with an ailment and leaves relieved to be either treated or cured of whatever ailment they have. But during my time, I thought maybe there's something bigger that I can do. Maybe there's a bigger impact that I can leave. So I decided to take a step back. What is a bigger impact that can be had in the healthcare system, or what is a bigger impact that I can have on that system than working to lead and optimize it to a better extent? So working to develop the framework of healthcare, whether that be abroad or here in Kuwait, that to me sends a bigger message and impact than working within the system. So taking a step back, I decided to see healthcare as a machine as opposed to just the cogs within the machine. So just simply fixing the cog, I decided to take a step back, look at the machine, and see what best can be done to improve it. And reaching that decision is what led me to healthcare strategy and healthcare management. So managing that healthcare system, to me, has a bigger and lasting impact than working through it, whether that be a mismanaged or a failed system.
What things other than innovation, other good things that we can borrow here in Kuwait and in other GCC countries?
So I think that Kuwait has the proper, and the GCC to an extent, has the proper infrastructure, has the resources to be one of the leading healthcare centers in the world. I'd say one of the main issues here would be fragmentation. So different systems, different departments don't communicate as smoothly as they should. You might have experienced this as a patient. If you were to go to one clinic and then move to a different department and then a different hospital, you could very well be repeating the same history in all those three different places. You might be repeating some unnecessary steps that you shouldn't. So that fragmentation leads to longer times. It can lead to a loss of resources when it can be much more smooth. As I spoke earlier, patient flow is something that I'm very interested in. So how to get the patient in and out of the hospital in the best manner possible. So in terms of what we can take from the West, I wouldn't say that importing their ideals would be best. Translating them, adapting them to the region would be a better solution. So taking their innovation, their take on how new technologies are advancing medicine and implementing that in the region would be best. However, there are other aspects such as the for-profit and capitalistic nature that I would leave out.
And the digital transformation, are there any cons for that, or is it a proven thing?
So digital transformation is a must, and I do believe that here in the region, it's something that we're primed for. It's something that should be done given how the region is quickly developing. So in all different industries, digital transformation can be seen in almost everything, whether it be using your app for banking services or telecom or whatever it may be. So why not use something similar for healthcare? Why can't it be easy for you to get access to care from home? So there's a lot of things that you could do with digital transformation that are also available abroad. But as I mentioned earlier, given the for-profit nature of these elements, they've been more rapidly adapted because of how much profit there is in it. But I'd say in Kuwait, it is something that we can see in the near future. So digital transformation is a must if we were to develop our healthcare services in the future. In terms of digital transformation, having it implemented here within the region, it's very much possible. The region is primed for that leap to digital transformation. But I'd say our main setbacks is our hesitancy, our wait for clarity. Taking that step towards digital transformation is in itself transformational. So having leaders that can lead us through that chaos and help implement and execute that transformation here in the region would be an added value to the healthcare system.
What do you say for people that are trying to follow your path? Maybe an advice, one good advice you can give them.
I'm not sure I'm one to give advice, but I'd say stay curious. Explore different things. Life is too short to just stay on one certain path. Explore different things. You never know. You might be best at doing something that you never could have dreamed of. You yourself, Sulaiman, coming from an engineering background, did you think that you'd be a host of a podcast a few years ago?
Nope.
Yeah.
It was just something on the side and it came. Yeah. And I took it. Yeah.
So yeah, exactly. So curiosity. So keep your mind open to different opportunities. You never know which one might work out. So keep that in mind and start. So a lot of people are, and I'd always say this, so it's good to have a plan. It's better to have a strategy. But anything more than that, and it's crippling, you'll just end up thinking of things over and over again and never actually start. So execute, start, and go ahead. Yeah, best of luck.
Okay, Dr. Ryan, appreciate it. Thanks for joining today.
Thank you for having me. It was great talking to you, and I hope that I was of at least some benefit to you or the viewers. And yeah, best of luck moving forward.
Yeah, very beneficial. I appreciate it. Appreciate it, man. Okay, and thank you guys for tuning in. Please share this with your friends, relatives, anyone, and make sure you like and don't forget to subscribe as well. And have a good one. See you.